Hi, everybody. It's Dr. Linda from the Vascular Birthmarks Foundation. Welcome to our Facebook Live. Today, I'm with our guest expert, Leslie Graff. She's a child life specialist and the VBF psychosocial expert. You've been with us how many years now? Based
13?
on your son, 13 years. Today's session is all about you. All about you with dealing with your birthmark, dealing with your child's birthmark, as I said in the promo before. Ask questions about how to cope with people who are rude, who make comments, how to deal with the vascular birthmark in the family system. I worked on this in my PhD. Leslie works on this. She helps prepare children for surgery. She and I have worked on some projects with this. We know it's very, very important. Hi, Vanessa. Hi, Roy. Welcome. Hi, April. So we can take your questions. We only have 1 hour. By the way, Leslie and I, for everybody listening, will be in Greece in June at the VBF I-Team Greece conference. So any of you watching this from outside the USA or even the USA, we have free laser with Dr. Geronimus and Dr. Nelson and a free clinic. So, and we also have our conference that's coming up hi, John. John Berger used to be the vice president of VBF. Nice to see you, John. Hi, Erica. So we have a conference in October in California with free laser, free clinic. We have one in May with Dr. Duarte. She's one of our experts. That's May 4th and 5th with free laser. Check out our website at birthmark.org to find out about getting your free laser treatments. Hi, April. Thank you for being there to monitor. And anytime throughout this session, if you don't get your question answered, April will post my email and Leslie's. So there's our first question from Sherry. Hi, my son has CMTC and has problems with bruising, and no one seems to know how to handle it. Any ideas? I'm assuming she means, and listen, I was one of those parents. A lot of parents with babies with vascular birthmarks that have bruising get accused of child abuse. So this is a really good question on how to deal with that.
Yeah, I think it's always difficult situations because a lot of times people don't have an understanding of the birthmark, right? And so having ways to explain that is always very important, like simple ways, so that people know if there's, this is normal for my child, it goes with their medical condition, this is, having ways that you can very quickly and succinctly, or if you see someone's sort of looking at something sideways, you can make a really simple comment about how that's part of your child's condition. It's a vascular condition. And I think especially when people understand vascular components to these, it's much easier to understand like how bruising is a part of that, right? Because when we have trauma and stuff, we get bruises.
That's a good idea. Like even you have surgery, you have any kind of trauma, there's always a bruise, and that this is a vascular birthmark and the blood vessels are different in it, and you get into that mode of being an educator, and that can diffuse it. Emma has a medical question. I can actually answer this. She's had a pulse dye laser done. Is there anything that would work better? The pulse dye laser is the #1 laser right now. The Prima is in test mode. It is not ready to go live yet. Depending on where you are, Emma will have free laser in Greece this summer and in California in October. Check out our website. Hi, Kristen. Again, so there's postings on vascular birthmarks to submit a question. And then April or Kristen, if you can list the conferences links so people can read about where we will be this year for free laser and free clinics. Amen. Hello. Do you remember me? I'm from Syria. My son Sam has a vascular fever and he needs laser. Is there any way, depending on where you are, if you can get to our conference in Greece? Why does the laser not work for port wines on palm or arm? Most of these are not psychosocial, but that is a good question. The farther away from the heart, the hands and the fingertips are the farthest, and the toes, the more difficult it is to treat. So you just have to know that. And but there are doctors who will try. Hi, Vanessa. So her daughter is very young, 10 months. We love her daughter. She's one of our little birthmark babies. She's wondering at what age to start talking to her about her port wine. At what age do children start asking about their birthmarks, starting to feel hurt feelings about people's comments? The mom is.
I would say that this really varies from child to child, and I tend don't even develop a sense of like awareness that that's them in a mirror till about age 1. So sort of, and even then to be able to sense that they're different from other people takes a little while beyond that. And so I think it's, for me, I have a child with a port wine stain. So it was always something that I never avoided discussions of. I never, it was always part of the stories we told. I remember when we would go to Boston to have treatment, and which he didn't really recall because he was pretty young at the time. But I think you really let the child take the lead when they start to ask questions or say things about it. And if you're always treating it in a very matter-of-fact manner, up until that point, you don't need to draw extra attention to it. You don't need to deflect away from it, just in a very matter-of-fact way, like you would treat anything else on their body. And then I think you kind of wait for them to say things, or as you start to notice things in their behavior, if they're trying to hide it or they seem more self-conscious. But for many children, they can be up into early elementary school before they really start to articulate or notice, because a lot of times younger children don't really notice it so different as differences that other people have, like different colors of hair. Somebody might say something, but it's generally not mean-spirited. It's more curious, and so children tend to pick up that it's more of a curious energy.
Yeah, and they say too, children have a older age than we think for mirror recognition, for when they actually recognize themselves in a mirror.
Mm-hmm.
So they're like, oh, what is that? Like it's not what we think. We think we're looking at them at 18 months, and that when they look at themselves in the mirror at 18 months, they recognize it, but they have no recognition at that young age. Greg Shelby's got surgery next week. Tim, that's a really good one, Tim Lee Russell. He said most people think he's been burnt because of this port wine stain. And again,
it's just educating people to say, like, this is a vascular birthmark, not a burn, or not a... Because sometimes, too, it changes how people perceive you, right? If they think you went through some trauma versus something that's just always been a part of you, right? Kind of changes how they maybe perceive things about you or questions they have about you.
Good point. Andrea's daughter is getting ready for her first sclerotherapy. She's 5 years old, and she wants to know how to prepare her.
Okay, that's an excellent question, because anytime a child's having a procedure, I think it's very important that we do whatever we can to prepare them for the procedure. So as a child life specialist, there's a few things that we sort of look to talk to children about in developmentally appropriate ways, right? So she's 5. So we have to think from the mentality of a 5-year-old. What are they afraid of? What do they understand? What do they not understand? What's going to be difficult for them? But we talk about the sequence of events, like what's going to happen first, then next, right? We talk about timing and duration. How long is something going to last, right? And we also talk about, like it might take this long, or you'll be asleep for this long, or when you wake up, we'll be with you again, these kinds of things. And we talk about the sensory experience, right? What will they feel? What will they see? What will they smell? What will it be like? So if you have access to a child life specialist through your hospital where the procedure is being done, you can request sort of a pre-surgical or pre-procedural preparation experience, where you may use like a cloth doll and some different equipment to prepare them for different things. Like, this is the anesthesia mask. You're going to breathe in and out. It gives you medicine that helps you fall asleep, but it's different than the sleep you have at night, because you won't feel anything and you won't wake up during that time until they're done. And so we try to explain to them what you can expect when the procedure is over. Will there be a bandage around it? Will there be, will you feel pain? Who will be there? Children at that age are often concerned about separations they may have, or how much something might hurt. So those are probably some of their biggest fears. So letting them know, you'll know it's all done when you wake up and you see this bandaged, or you'll know this is all done when whatever that is.
Do you recommend to like the parents treat them when they come out of recovery?
So I think it's nice to have something. It's not like a reward that you
Right.
give them, that you hold over them if they're good, but it's nice to have some sort of ritual or something that you can do that bonds you together or that makes the event special and less sort of traumatic or problematic. And another thing you can do is ask the staff of your physician's office to give you a little run through of how things typically work so that you can tell your child. And you can actually bring like a stuffed animal or a toy or something and be like, this is kind of, first they're going to go here. You can do it with little Playmobil figures. First they're going to go here and this will happen. Then we'll go and sit and
Good
wait
idea.
in this room. Then you say goodbye to your mom and dad, or then, whatever the steps are to sort of play through.
Great. Emma Sartori, regarding a skin graft for a port wine, most of our surgeons do not recommend it. Depends on how extensive it is. But if you're in London, I can put you in touch with our two chief surgeons, Dr. Coletti in Milan and Dr. Tom Brees in Greece, and you can get a opinion from both of them. Also, Dr. Coletti has the laser now in Milan, and he can treat it if it's treatable. So you can email me. They'll post my email at vbfpresident@gmail.com. Sherry said, thank you. Catherine Casamento, parents are tasked with staying strong for the child while trying to manage their own fears, worries, and feelings of helplessness as they watch their children undergo painful episodes and recovery from surgeries and procedures. Good intro. What resources are available for them who struggle watching their child affected by various manifestations of birthmarks, from painful procedures to hurtful comments, loss of friendships?
That's a really good question. And one of the difficult things is there are not a lot of diagnosis-specific resources out there. And as you know, like this might be different than somebody's experience of having a child with diabetes or having a child with, autism or another condition that affects their life in certain ways. I think probably one of the most important things is to gain support from other people within the community, and to try to reach out to mental health professionals as well for counseling and support yourself to really be able to articulate those things. I would also really suggest therapeutic activities, things like journaling, things that are generative, things that enable you to find ways to make meaning of even very difficult circumstances, things that promote a sense of resilience or a sense of stories, even when they have difficult sort of arcs to those stories. But I really think one of the greatest sources of support is other people who are experiencing what you're experiencing.
All right, so Michelle, let us know about the treatment that you said. And Lauren, your 2.5-year-old always points at her daughter's, your 6-month-old's port wine and says, boo boo. We have been trying to get him to say birthmark. Is that the best? Anything else we should do to try to do with him to help in the future?
That's an interesting question. I'm sure like as a young child, they're just still trying to like identify different things. Like you're always trying to relate something to what's known, right? Because you're expanding language and vocabulary at that point. But I think you can correct it by saying like boo-boos are when you get hurt. A birthmark is just there. He came like this. If it's a port wine stain, right? Like he was born this way. It's not from something that got hurt. He didn't get bumped, right? So you're just clarifying with language, but that will just take time, and that's very normative for children of that age to just identify something with the closest thing that they know. And again, the child's just reacting to the red color and thinking, oh, that comes, the pink or purplish, whatever color it is, that comes when somebody gets hurt, because I've seen somebody get hit with something and it turns red. But just reminding them they're not in pain. It's always like that, because their sense of permanence too may not really be there in the same way.
Yep. I just want everyone to know too that there are 62 vascular birthmark Facebook groups, and they provide a lot of support for hemangiomas, port wines, venous, AVMs, lymphatics. So find them on there. I have a list of them all. Very good support. Judy, she's 54. She said she has an issue with the remarks and stares. She thought she was getting better, but she said it just isn't getting better. She said she has depression and self-worth for socializing.
And I think, and unfortunately, that is how some people's stories play out, right? And sometimes we can feel like we're doing better with things, and then something happens, and it's kind of like waves, right? That crash over us, and we realize maybe I'm not all set with that. Because what the truth is, we're social creatures, and the things that people say to us do matter to us. The ways that people treat us affect us, and that's why it's really important that we talk about these issues. And I think a lot of times too, no one in your life is there saying, yeah, people don't treat you very nicely sometimes. Like in honest, open ways, are really acknowledging the hurt or those experiences that are very difficult for you. And so I think it's really important to have that and to be able to talk freely about that and to talk about that with others in meaningful ways.
So Jilly, she said she's sick of being stared at by other adults. Is there a way to overcome it, or is it a fact of life that will never go away? And by the way, Jilly, I'd like you to message me a picture of your birthmark, because there are some new techniques and some new lasers, and you may be treatable. So it's hard because I rarely see something not. But back to her question about being fed up with the stares and
unfortunately we can't control the behaviors of others, just as we can't in any situation. There's things that you can do to sort of calm yourself, to use different cognitive techniques to sort of focus on other things, to sort of create some coping methods for yourself amongst that. Again, like when you walk into a room, what do you want to think about? Do you want to stop and notice those? What messages are you playing in your head when you see someone? Do you think, oh, they're curious, or they don't understand this, or you know what, if this person lived my life, would they treat me a lot differently? And this is ignorance on their part, right? And so you can choose the scripts and the stories that you tell, even about the experience that you're going through.
I like that. Carol Kowalski wants to know how to support her 15-year-old who had the upper lip compound hemangioma, is 3 to 5 years old and still experiencing anxiety, and has tried to bury those memories. And that's the reason I want that done by one, to get these hemangiomas and port wines cleared up by one, because it's 3-5 years old. That's kind of
and some of that may still be too some developmental things going on with anxieties and concerns and fears that children normally have, but then also when you add these experiences on top of those, their healthcare experiences that may be difficult. But I would continue to suggest various therapeutic outlets, therapeutic play activities, anything that's creative, expressive, that allows safe exploration of different emotions. Sometimes there's like play that we do that's a little more aggressive and stuff with children that allows a healthy release of negative emotions, are really important in helping kids to feel balanced and heard and validated and understood in those experiences.
Stacy says that she's 47 and having her first treatment, yay, in October. Her port wine's on the right side of her face. I wish I had courage to not wear makeup. I don't see anything wrong with it. We support whether you wear it or not. She said, I've even had an adult ask me if my husband slapped me, and he would never, she put.
Well, and I think, it is always difficult. And some people say, oh, does wearing makeup mean I'm not okay with how I look? And people, especially those with a birthmark, feel sort of torn between, am I okay if I do this? Does it mean I'm not okay if I choose to wear makeup? But most of us, who do wear makeup on a regular basis, whether or not we have a birthmark or not, choose to do that because it makes us feel more comfortable. And so to think that you're any different than anyone else is really not the case, right? We all put that on because it makes us feel more confident and more comfortable. And if you're using it in that way, that's not a negative thing. And, I think sometimes when people make comments, or wonder, did someone hurt you? Did someone do something to you? Sometimes if you actually think about it, the person is motivated by a desire to be like, do you need help, right? Or they're concerned for you, even though it's a very rude accusation that they're often making. It sometimes comes from a roundabout place of actual care.
So Lori said her daughter is 13 and she has a VM on her backside, and she's very uncomfortable with how far it sticks out. She has a hard time with how it makes her, cancel that. I don't want to end this. With how it makes her look. She often asks me why me, and is insecure. I feel bad because she's at those teen years. Nothing has helped. Well, first of all, please email me, Lori. I'd like to see her picture and at least have our top experts say there are no options, because Dr. Rosen and our team with extremity and buttock lesions, Dr. Fishman in Boston, they're amazing. But this whole why me?
Yeah, I mean, I think that's a really difficult thing. I think one way that's helpful is to sort of point out to people that everyone in their life has things sooner or later that may be difficult. Yours may be in this particular condition, in this particular way. And for other people, they're very different things. They may be in different sectors of their life. Maybe they have very challenging relationships. Maybe they have very, other physical or neurological or learning disabilities or any different types of things that we all have sort of adversities in our lives. And yeah, there isn't the best thing that you can do is find a way to make your story powerful, find a way to make something good come out of that experience, and to have that empower you in a way to help others and to use your personal experience to help other people who experience things similar to you. And that's one of the greatest ways that you can become powerful in that experience. But I'd say really looking for ways to improve her sense of body integrity and body image in other areas, because sometimes we can't do a lot about one part, but we can focus on other parts that might make us feel more confident and more comfortable.
Great advice. Christy says she's 43. She has port wine with Sturge Weber. Yes, you can have laser and it will be effective. And Christy, if you send me pictures or go to our website and email Dr. Nelson, he's one of the leading port wine stain laser experts in the world, and he'll tell you about how many treatments you need, and he's right at birthmark.org. Thank you, Emma. Mary Ann Esquile, my son is 14. He has had PDL laser since he was a baby. We just met Dr. Duarte. Yay! She's amazing. My son wants to know when we might learn of progress on the new Prima. The Prima is being tested right now with Dr. Geronimus, and they're working out some of the kinks. So stay tuned. I would say like by next summer, but they're, can't go forward with kinks. So hi Jody, haven't heard from you for a while. FYI, distinctly remember that around age 2 was the time I recognized having a birthmark. It's 2-ish. While looking in the mirror and pressing on my mark, I could see white in the momentary. I did not, though, realize that I was different from other kids until I started getting teased about it, maybe around age 3. So that's that 2 to 3 age, right?
Yeah, and I would say that's even early for what a lot of other people would say in terms of when other people really start articulating about that. And a lot of it depends on what age group of children you're interacting with, right? If you're interacting with other 3-year-olds versus 6 or 7-year-olds, right, that sort of changes a lot of the dynamics around that experience.
So Shelley said she hears a lot about infants and toddlers, which is good, but there are a lot of older adults too out there, yes, who have vascular birthmarks before laser was common. Yes, it was considered cosmetic. It would be interesting to see how these older adults deal with it.
It's always interesting at conferences. We often have adults come to sessions and talk. And I often say, it's very helpful for families of younger children to hear from people who've lived their whole lives with it. How have they been able to deal with certain situations? How have they come to terms with it? What strengths has it? What are the hardest parts? What are the strengths that have come out of that? And I think that's a really great audience to tap into to really be able to share and help provide support.
And again, the support groups online are great for chatting with each other, coming to our conferences to network. And our mission, we changed it to say acceptance for people who choose to live with a makeup or choose not to wear, or live with a birthmark, who choose not to wear makeup, who choose not to have treatment. But really good question. Kim said her twins are almost 12, both have VMs and BR, not sure what that is. Are there any support groups where kids talk to each other about their concerns, fears, similarities? We used to have that, but it got into a little issue-y with the whole MySpace and people going off things and parents calling us saying there was inappropriate things going on. So what we do, Kim, is at our annual conference every year, the kids can get together. We allow that in the young kids room. That's really the best we have, only because everything is virtual and then there's just really no way to control the creepers that might
And
end
when I do psychosocial support sessions there, we often have them by age. So when we have ones, it's like teens, other teens will be sitting there talking. Their parents may choose to be there, but they tend to be pretty open. And we really encourage the majority to be as much as they want to lead out in those discussions and share their experiences. So it actually is really validating for them to hear other teens and be like, oh yeah, I totally understand that. And so I think coming to conferences is actually one of the most meaningful ways to get that sense of, yeah, somebody else knows what it's like, and somebody else, I see these other families and I realize someone else is living a story that's a lot like mine.
Shelley, there's been a lot of people that have had their port wine stains cut out. And if they're small, it can be done, but it depends on the size. And again, today, the laser is the premier form of treatment. And we're doing our best to educate families and physicians. Hi, John. So my experience is everyone is self-conscious about their looks. It's normal with the birthmark. You get comments from people about your looks. What is important is to have or develop a positive mental attitude about yourself and exude that confidence. I know it's difficult to look someone in the eyes who is staring at you, but understand that many are ignorant about a birthmark. This is true. There are several good sports-related books about developing positive mental attitudes. That's great. People are attracted to confident people who they perceive to be leaders and look up. A friendly smile and winning attitude will make you will make you many friends. Even look at yourself. Ever look at yourself as a victim? Say, look what God did for me, not what God did to me. Thanks, John. John's the former vice president of VBF, and by the way, very handsome. A lawyer. His wife is a lawyer and a former AG or with the Department of State, like very high up, very competent, intelligent. Motocross, still races motocross motorcycles. And not only does he have a port wine, he has Sturge Weber and KTS. So he's got it all and nothing stops him. And I mean,
and I like the comment because I always say it's really important to help children and adults to find your identity in what you do, right? What are the things that you do that contribute in this world? What are powerful? How do you affect the lives of other people in positive ways? What can you do? And I think when we see identity coming so much more from those things than from an outer packaging, right? That's when we feel a much greater sense of purpose and power.
Yep. Hi, Ashley. She just joined. Shelley says, makeup is great. Makeup is a coverage for us, but really makeup is supposed to be an enhancement. We do free makeup sessions at our conferences because people want to see what they look like with it. I wear a ton of makeup. I have acne scars. I have insecurities about my face without it. Sometimes it's for camouflage and sometimes it's to enhance, and that's the role of makeup. Sometimes it's to enhance your eyes and sometimes it is to camouflage. Marianne said her son is 14. He has had PDL lasers. Oh, it is? Yeah. Okay, that's right. Yep. Sorry about that. That must have repeated. Deborah said she's 55. She has a VM on the right side of her face. I've dealt with a lot of anxiety and depression. I would love to be in support groups. Dr. Wayner has done my last surgery in Arkansas. Yes, I remember your name, Deborah. So Deborah, there are a lot of groups online. If you want to come to our conference, we do free hotel, free consult. It's October. It's on our website. I think it's Columbus weekend. So I think it's like the 10th, 11th, or 12th because Columbus Day is late this year. It would be great for you to come and meet other people. And also, if you need treatment, let me know. Jody, hi, Jody. She likes that comparison about anyone, even without a port wine, might wear makeup to feel comfortable. Yeah, it's true. Sometimes these adversities make us better people. I've heard that a lot too from people. That many parents of children with port wines and hemangiomas, many, and I've done this for 25 years, tell me that all the children in the family are affected and that they all become more compassionate towards children that have disabilities or differences or challenges of any sort.
Yeah, my graduate thesis actually looked at children, the siblings of children who had different disabilities and medical conditions. And that was one of the findings, was the resilience and the positive impact that that had in their lives in terms of the way that they treated other people, the way that they saw people's experiences in much more thorough and compassionate ways. They were able to put themselves in other people's positions and be a lot more understanding to things that other people were going through.
It's great. Yeah, so Lori Kinberg, you can get my email, either April or Kristen will post it below for you, but it's vbfpresident@gmail.com. You come to our conference, Jody.
Jody,
we haven't
please
seen
come.
you in a long time. You used to come.
We had a lot of adults. I think I had my largest adult session at the last conference.
We
it
had
was really an
340 people. And Leslie does an adult session just with adults, a child session with the younger kids, and then a parent session. So it's critical. It's amazing. Daniel Willis says his son is 6 and we chose not to treat on his face. He's been teased and looked at. We recently asked him if he wanted to treat and he told us no because he loves that it makes him different. Everybody has their personal preferences. Hi, Shannon. Madi says, hello, thank you. I have connected with you a few months ago regarding my son's VM. Contact Dr. Rosen. I tried to connect several times, but I haven't received any response. You can email me through vbfpresident@gmail and I'll forward it to his physician's assistant. Okay, so Natasha says her daughter's 14 months. She has a hemangioma on her arm and has lately been rubbing each arm and seems confused. I kiss her arms and express to do nice. She sometimes scratches it. I mean, it literally can itch. Hemangiomas, because the tissue expands, can have, and especially if there's, and if they're ulcerated, they hurt. And with the stretching, anytime skin stretches, it itches just because of the expansion.
And sometimes too, you can just provide other soft sensory experiences. Maybe it's like a furry blanket. Maybe it's a cool washcloth, like other things too. Because a lot of times, babies tend to react to, and young children react to that sensory experience that they're just not sure. So if you can provide a calming sensory experience, right, that just changes a body sensation. That's something we do a lot as child life specialists. Is it sort of provides a form of distraction or an alternative focus that's more positive for the child.
It's great. So Carly says, occasionally adults at shops will ask inappropriate questions about my son's port wine, wondering how best. And I saw a lot this week from parents saying the most unbelievable things. Like a doctor said to a woman whose baby was born with a port wine, oh, your baby's got a mark like Gorbachev. So like crazy. Yeah. So what's the best way?
And so many times it is, people will say it's the adults that are the worst, right? Like the children are the ones who just ask curious questions, and the adults are the ones that say these horribly insensitive things or just interact in these very rude ways. And I think, different parents will always say, on different days, some days I feel like treating it in a very polite way. Some days I ignore them. Some days I give them sort of a short response that lets them know that they're being kind of rude. And so sometimes you can just say, it's part of a medical condition, but I'd rather not discuss that with you right now. Or you may say, it's a birthmark. Maybe you have something too. And I think what's difficult is when our differences are visible, right? It sort of invites someone else into our realm. Whereas if someone's medical condition or difference isn't visible, they don't have to talk about that with other people. So it really becomes a difficult space of boundaries. But I think different people, you can come up with sort of a few set responses that you can pull from is the best way to just sort of have, these are my lines. And if I feel like sharing more, I'm going to educate and say this. If I really don't feel I have the stamina for that today, I'm going to say this, right? And have different ways to address that, or to sort of shut it down, or to say, it actually makes people really uncomfortable when you ask them questions about things like that. I know you're curious, but we don't feel like talking about that today. And it's okay to set limits on what information you choose to share.
So Isabel, regarding your son's hemangioma that has ulcerated, email through the VBF website, Dr. Stuart Nelson. He's our West Coast expert, and he is the master of using lasers to treat ulcerated lesions, and he will talk to you, see if there's anyone in your area or if you choose to go see him, but he's the master. So you can send him a picture and he'll provide you a free comment. Hello, Kimberly. Luca always checks on Frankie's hemangioma to see if it's shrinking. He asked if he could touch it. Kimberly's daughter, Frankie's one of my babies, and she had a large, massive base of skull hemangioma she almost bled out. It was a very bad situation. And I think what people forget, and I talk about this all the time, is the PTSD. And Kimberly and I have not stopped talking to each other in the couple of years we've known each other. And it does affect the entire family. And that's what people don't realize. Like, here's her son. He wants to check on it because they're all like, is she okay? Yeah. And I think that's a dynamic that doesn't go away.
Yeah. And I think even too, yes, like when it's appropriate to touch, or, it gives a different sense of body integrity. Like, even though part of you may be different, it's still okay to touch that part of someone, right? Like there's sometimes a hesitancy or a total avoidance, and that actually sends a really strange subconscious message to the individual when it's like, nobody will touch the right side of me, or people are sort of afraid of that. They can sense and feel that. So the more normative that things are, again, the more helpful it is to have the most normative, matter-of-fact treatment as anything. But it's very cute to have that concern and that.
Yeah, she's got great kids. She's got a ton of them. No more babies, Kimberly. I keep telling her. Julie says the adult session was excellent. We could have talked for hours, so she was there.
It was great.
Yeah. Dinah said her son is 2.5 years old and has a port wine on the right side of his cheek. What are some simple phrases I can teach him to say to other children? Awesome question. He mainly interacts with children of the same age, so 2.5 to...
You can say, it's a birthmark. I was born this way. Or, it doesn't hurt. Nobody hurt me. It just is like, it's red there.
Yeah,
always.
my birthmark.
Like, it's my birthmark. Like,
I like that.
So really simple phrases. And then, of course, as they get older, you can explain it a little bit more. Like, why does it stay pink? Well, just like kind of like when you exercise and there's more blood and your face looks red and flushed, right? Because there's more blood in that area, or the vasculature is more dilated, right? And so just helping people understand that's what it is. And then when they understand it, they're like, that totally makes sense. Now I get it, right? Mm-hmm. And it feels less pathological to them when they have a little bit of that understanding and can relate it to very normative functionality that they already understand. But of course, you just start with really simple, small phrases that are just exactly what it is, right?
Well, Natasha, regarding your question on a cream or topical, at our website is Dr. Ana Duarte, and one of our staff can post her email. She's down in Miami. She's our ped derm expert. She's really good about getting back quickly to tell you and send a picture so she can give you the right name of the cream or topical to use for the itching. We're finally able to get my daughter's facial hemangioma surgery at 14, right before high school. I just wish that, my wish is for treatment to start at 3 or 4 weeks so we can avoid surgeries. And that's why VBF is moving to the done by one for hemangiomas, because she's got to have surgery at 14. Tell you it has made a huge beneficial impact. She's happier than she's ever been. I'm so glad we got her surgery. Thanks be to God. One day when I am feeling very sarcastic, I'm going to tell someone we got her face tattooed with her favorite color. Oh, Vanessa, I want your husband to video that so that we can show that, please. I love it. Joanna Nelson, I was born with a large port wine on my face. I chose to have several lasers starting in my 20s. It's a personal choice. That was a miracle for me. Thank you for sharing that. Bobby Joe said her 6-year-old granddaughter has a hemangioma on her face and part of her ear. The doctor said it was okay to get her ears pierced. Now her ear is swollen. I feel like hemangiomas are hypervascular. The red you see is engorged blood vessels. So that's normal that it'll be swollen, but it'll go down. Don't worry, Graham. That's okay. She'll be fine. Jody, okay, great. I'm so glad you're coming. It's so, I look forward to seeing you. We all haven't seen you in a long time. You'll see Glenda and Tiffany and so many people from the old gang are still there. Corinne. Roxanne's on as a mature woman who's lived with KTS on my right leg, hip to toes. I agree with John. whether it be their ignorance or curiosity. I always focused on what interested me and got involved in that community. Often my parents feared of how people would react to my participating in tennis, skiing. Wow, swimming, you do more than I do. They couldn't say that. I couldn't because of how I looked. I found that I had to show the ignorant or those who felt sorry for me that I had just as much ability as they did. I learned the boundaries of my comfort zone, and after a while, these same people saw beyond the KTS. It's amazing. Very awesome.
And we have some incredible people that I've worked with, children and adults, through VBF over the years who've done amazing things despite challenges, despite pain or conditions that sort of make it difficult for them to participate in things, but they haven't let it stop them and have gone on to do just amazing, incredible things. And whether it's sports, adaptive sports, like you name it, it's just so impressive to see. And I think that really helps to not only benefit their life, but to help others see beyond those visible differences.
Hi, Karen and Scott. They're both on. Erica, the questions like that, the physicians have to look at the picture because the topicals, it all depends on what they're seeing. They all vary. So unfortunately, I can't see pictures, so we can't ask that here. But you can ask Dr. Nelson or Dr. Duarte. So I have a question before the next one pops up. And this is always a question that I get. There are a lot of parents who say to their children with the hemangiomas or the port wine when they're little, angel kissed you, it's a gift from God, and then they take it off. And then the kid says, why did you do that? You said it was a gift from God. An angel kissed me. I want it back.
Yeah.
Like, do you discourage that? Or
I prefer more of like a matter-of-fact response to it, to just be like, this is a birthmark. This is a part of your body, because I never want it to be seen as you have to have this or you have to not have this, right? So people can make decisions about treatment without feeling any sort of guilt, because I have had patients that said, you know, my parents always made such a big deal about it that part of me felt guilty pursuing treatment, because I thought, well, they always tried to make this be the thing that defined me. And I didn't really want that to define me, but I wasn't allowed to have anything but that be how they reacted to it. And so I think it's very important because, too, there's limitations of treatment, right? Sometimes treatment is effective for your condition. Sometimes it's less able to create change. And so you always want to be like, you're okay with it, you're okay without it. That doesn't define you. And your choice, too, if you choose to pursue treatment, it doesn't make you a weak person. It doesn't make you somebody who's not okay with who you are. It doesn't, like, there is no judgment on pursuing or not pursuing treatment. It's what you think is best. And so, yeah, I think you have to be careful sometimes about the language and maybe the story that you tell around that, so that nobody feels sort of guilt or problematic about choosing to. We can all talk about, we all have differences, and this is part of your story, right? This is part of your story, but not necessarily that the mark was intended to always be there, right? So,
I love that you focus on the medical, just like there's people with the condition where they have one blue eye and one brown eye, and you focus on that's a medical condition, or one ear is different than the other. Always focus on, this is a vascular birthmark, it's enlarged blood vessels, or whatever it is. And I think you can't go wrong, rather than worrying, are you going to make it to be something bad or something good?
Right. It just is.
And some cultures, right? I've had people from different parts of the world say that the birthmark was like a sign of demon possession, and others told me they said it was a sign of royalty. So that's the whole cultural competencies. So Scott has a great question. Hi, Scott. He's a parent and he has an extensive port wine on his face. His son's friends, his son is like 8, I think now, or 9. His son's friends sometimes have questions. A fear of Scott's is his son being bullied because of his appearance. Any advice?
I would hope that wouldn't be the case, right? And I think if you're aware of, you know, like as an adult, you're probably especially aware and attuned to that. I think it's awesome that they may have questions or that you answer that. And sometimes, especially with tweens, younger teenagers, you can kind of say the elephant in the room, right? Without even, like, somebody may not ask you a question, but you may notice they're eyeing you, and you might be like, hey, I can tell you notice something's different about me. Like, everyone can tell I have a birthmark on my face, right? Like, and
and Scott, you can say just like Drew Brees.
Yeah, so you can be like, it's and I think, as kids get older and older, their understanding is more like, hey, that's part of your life, part of your experience. But you're a totally, interactive, helpful, like, again, you want them to see your identity for who you are and what you do and how you are as a parent and the awesome person that you are, and not defined by that. But it's also okay to be like, yeah, I know it can look a little different. I know it's not what most people are used to. And also that your child didn't, they didn't choose that, right? Like, and so in some ways too, when you sort of eliminate that sense of control, it helps people to be more like, oh yeah, I shouldn't treat someone differently for something that they had no choice in or no ability to affect in those ways. So I think that's always important too.
Yeah, I love that question because Scott has brought that up since his son only recently has had friends saying, hey, what's that on your father? We forget that the sons, the children's friends and so forth.
It becomes a part of the whole community's discussion, right? And
yep. So Melissa has a 15-month-old daughter as an upper lip and philtrum hemangioma. She started the propranolol at 5.5 months. Yes, they are very stubborn. Also, you can write to Dr. Duarte. Her email is above in the scrolling up there, because she'll tell you the dose based on how much the baby weighs, because it might have to be changed. Because as they get heavier, you have to increase the dosage. So Melissa Surgeon, look above for Dr. Duarte's email and email her and tell her the dosage and show her the picture. Natasha, I love your response. I will use all of this while my daughter is growing up. You're very welcome from both of us. Ada said, thanks for this great discussion. Why my son's port wine stain comes and goes. Usually I cannot see it till he cries. So let me tell you, there are some port wine stains. They kind of cross into the midline capillary malformation range or the CMTC range, where they do, temperatures make them almost fade out. I've been, meaning to talk to some of our laser experts about them, because I don't know if they're deeper so you don't see them, or if they're just so shallow you don't see them. Because a lot of parents that have those real dynamic fading port wines say, should we get laser or not, if sometimes it's gone? And that's a good question to ask our two laser experts, and I will. And then she's saying, I'm wondering if there's any chance that it goes away with his angel kiss and stork bite. By the way, the angel kisses, which are here, the stork bites, which are at the base of the neck, are the ones that can fade out. And you can get all 80, 90% fading, but when they swim, they go in the pool, even when they get older and they get angry, they're doing sports, that a little bit of that will pop up now and then. So they fade, but they don't completely go away.
And most port wine stains still too get darker with certain things, like my son's will, right? At certain times, certain conditions make them appear darker than they are the rest of the time.
Yeah, Scott's writing again. He goes, Drew Brees, I just know little boys are and can be rude. You're right. Yeah,
They can. So the best thing is just to treat things as straightforward as you can.
Yeah. Exactly.
And sometimes too, like with tweens and teens, if things are rude, sometimes you have to say, that's not very polite, or that's rude. And not to the point that makes people uncomfortable in terms of disrupting the peer relationships. But it's okay to be like, well, just he didn't pick that, It's not my son's fault. It's not, anyone's, but I think you're doing a great job just trying to be involved in there.
And before, we do have we got 12 minutes, but one of the things we do is we have the Buddy Booby Birthmark book. And it is a wonderful book about the booby bird from the Galapagos Islands. He has a port wine stain on his beak, and the wise old owl lets him have one wish. And of course, in the book, you think he's going to wish for his birthmark to go away, but that's not what happens. He wishes for the animals to be safe and not poached. So it talks a lot in that book, a big message about acceptance for being different, being unselfish, and It's a wonderful book for children. We have them. We have thousands of them. If you can't afford the $10 donation, we will send you one for free. And we hope in May, during our month of awareness, that you'll read the book in your child's class, or just in any pre-K or kindergarten or first grade class. Or if you have an older child like Scott, like your son, you can possibly ask him to read it into a lower class to teach those kids about vascular birthmarks. So we've had we can take a few more questions here. So I see we've had 95 comments. Oops, where are we going? Oops, sorry about that. All righty. The other thing is, like I said, our conferences. So go to thebirthmark.org/conferences. In May, Dr. Duarte has a conference at Miami Children's. It is the Miami doctors will be there with myself, and they have a free clinic and free laser. In June, Leslie and I with the VBF I team will be in Greece. We have the psychotherapy sessions there. We are having free laser and free clinic. And then in October, Leslie will be back with VBF in California to our conference. That's Columbus weekend, that Saturday. I think it's the 10th or 11th, whatever it is, in Irvine, California. And Leslie's there doing the parents, the young kids, and the adult psychotherapy sessions. And they're just absolutely fabulous. And we encourage you, if you do go to our conferences, to share phone numbers with each other and stay connected. And also, like I said, there's like 62 different support groups online for vascular birthmarks. Let's see, I just missed one. Joanne. Hi, Joanne. I wanted to add, even though I've had a lot of my birthmark removed, right, it's still a part of me and the person that I am and always will be. You're right.
Well, and I think, one thing that I always encourage for all populations, whether you are a parent, whether you are a child, whether you're a teen, whether you're an adult, I'm a really big believer, and we see a lot in research on the power of journaling, right? Of just having a place to articulate and give voice to the different things that you're feeling, whether it allows you to sort of identify and kind of put in a box certain feelings or experiences, or explore them in different ways, talk about potential solutions, or, should I do this? Should I do this? It's a really great way to sort of talk yourself through different experiences and kind of come to a better sense of how it has impacted you, how it is impacting you, places you'd like to change, sort of your own ambiguous feelings. And sometimes, we feel these tensions within that experience of, well, I want to look different, but I am okay with who I am. And, how much energy do I put into this? And, I'm not really sure, how many treatments do I pursue? Is it worth pursuing more treatment? Is my child okay? There's so many sort of questions and fears and concerns that are associated with living with these conditions, that it's something that I would really suggest for everyone across the board to be doing just on a regular basis for your own sort of sense of mental health, for your sense of feeling in control in terms of living with your experience. And always, all therapeutic outlets, creative outlets, gardening, filmmaking, vlogging, music, drama, things that really show the power of the individual voice, the power of difference, the beauty of difference. I'm an artist, and so that's something that's really important. Is what makes a museum incredible to go to is that all of the paintings are not the same, because we would all hate going to a museum where all of the paintings were the same. And so it's learning to see how those differences are really valuable and unique, and make a difference for us.
I'm just seeing why some of these comments are not showing up. Let me just see. Oh, how do you feel about using the language removed in regard to laser treatments? I try to advocate that we are doing it to keep her skin healthy as opposed to taking it away. That's a great question.
Yeah, and I think when we talk about why we choose to have treatments, I usually like to use language like reduces the appearance, or maybe is less affected, right, by the treatment.
Mhm.
Because sometimes when we say removed, it sort of, again, makes us, or I'll hear parents sometimes that will say, well, my child's isn't that bad. Well, no one's is bad, right? And so we sort of stigmatize, again, the birthmark, making it seem really pathological. And then in the sense of if it's not clearing, we're living with a pathology or something that's bad. And so, yes, we can say, you know, I would like to have it lighter. I would like to have it less noticeable. I chose to treat it so that it hopefully won't have cobblestoning in the future or thickening and things like that. So I'm sort of maintaining it. And again, yes, hoping for the most healthy, least affecting outcome by taking sort of a more proactive role in the treatment of that. So
I like what Rob says. He's from London and he has Sturge-Weber. He says he responds with a big smile when they look
That's
at
awesome.
him. I love it. The best offense. Kathy Casamento said, while this presentation is great for those with port wine, will there be any future talks? Well, the KTS and port wine are all in this for the psychosocial, but we do have, we've had 22 Facebook Live sessions, Catherine, and you can go through them all. And we do have some that talk about KTS, some that just talk about Sturge-Weber. So Dr. Wayner's on, and quite a few of them. I'm getting ready to schedule one with Dr. Rosen, who just strictly treats KTS, and or Dr. Delphinian, who's another just strictly KTS expert. But you have to remember, a KTS is a multiple of things. It's a stain, a cutaneous stain, and it's tissue, muscle, and sometimes bone involvement. So just by its nature, it crosses over into some of our different birthmark areas.
And I think we'd always love to be able to, you know, maybe someday in the future we'll be able to have sessions that are dedicated, again, to just those psychosocial, emotional aspects of specific conditions, you know, as we have more resources or more opportunities, because I know that there's a lot that's sort of diagnosis specific for some of these, and wanting more support and specific answers and guidance within those diagnoses because of the way that it affects your child or you or your family in very specific ways. You know, it's a different regimen of treatments often, or types of procedures or life experience for each of those.
Well, we only have 4 minutes left. So Joy Rose said, we have contacted a dermatologist to meet with my 5-month-old daughter to have it removed for cosmetic reasons. Does the treatments hurt? Is the removal considered cosmetic? So first of all, I don't even allow the word cosmetic in the VBF library. The treatment of any vascular birthmark is not cosmetic, it's restorative. It restores it to the original embryology. Okay, so it is not cosmetic. I don't know what treatment. I mean, if you're talking about the pulse dye laser, there's, of course, when there's anesthesia, there's no pain. If it's without anesthesia, they use Emla cream, and they say it's like a flick of a rubber band like this on your skin. When the Prima laser, I'm going to New York to have the Prima laser just tested on my skin so I can report to parents how that feels. I've had the pulse dye done on my face, kind of helps with your wrinkles a little. And I had quite a few pulses with no anesthesia, so I could tell you that it was like a snapping. So again, you know, if you really don't want that, you can have the anesthesia. But procedures that Dr. Geronimus does that are under 45 seconds, his philosophy is, why put the child through anesthesia?
Yeah, I know.
You're welcome,
depending
Jody.
on the age and the location and the amount of treatment that's needed, makes those decisions more important.
Hi, Brad. I
how
haven't
to
heard
treat
from
them.
you in so long. Send me a picture. No, never mind. Good to see you, Brad. Chelsea, okay, so she's responding. How do you deal with regretting not seeking treatment sooner? That is an amazing question.
Yeah, and that's one that I get a lot, and I always try to tell parents and families, you've always done the best you can, right? We all know that, right? You love your children, you would do anything for them, but we can only work with the knowledge that we have at any given time. And, you know, we deal with this now, right? I wish I had more treatment, but think of people who lived before these treatment options were even available. Their parents are going, I wish I could have done anything, but I couldn't do anything. But the best is we can treat the best we can now, and the future just keeps getting better and better. The technologies keep getting like stronger and more able to do more things. And so the outcomes just keep improving and improving. And so we're hoping that the future just continues the trajectory that we've been on, and we're able to treat and help even more patients to have like better clearance.
Yep. So Marianne, Dr. Duarte's name and email are above, or you can email me. She is scheduling everybody for the conference in May. It's May 4th, 5th, the first weekend in May, a Friday and a Saturday, free lasers Friday. The conference is on Saturday. I hope I will see you there. You are all very welcome. Last question, Chelsea. I have a 1-month-old trying to decide about treatment. I just want you to know, Chelsea, we are promoting done by one. If this is a port wine, the sooner you start, the blood vessels are smaller, the skin responds better, and you can be done with it quicker. If it's a hemangioma, it absolutely needs treatment as soon as possible. Yeah. And 1 month is perfect for starting
and it's less
treatment.
traumatic for them.
Yes. Okay, everybody. Well, it's been great having you all. And we will be back next month with another Facebook Live session with Dr. Stuart Nelson to talk about all the newest treatments for head to toe vascular birthmarks with a focus on all the lasers. So thank you, Leslie, for a great session, and thank you all.
Looking forward to seeing you all in the future.
Take care. Here we go.